Good morning, everybody. I'm trying to get the meeting started. First of all, let me welcome you all to the second Global Center for Mass Gathering Medicine Conference. We are delighted to have a large panel of experts from across the globe, plus our local and regional colleagues and experts from the Ministries of Health around. I'm basically opening the sessions, the scientific sessions, on behalf of His Excellency Dr. Mansour Hawasi, the Vice Minister. We have a very exciting program. I think we're starting with a few introductory remarks about the Mass Gathering Center and the activities that have been happening between the different board members over the last year and a half. The meeting, of course, will start now, and then there will be the opening ceremony at 10 o'clock. It will last for 45 minutes, and then we'll have a break of 10 to 15 minutes to reorganize the podium and the setup for the ministers. And then the roundtable discussion of the ministers will last for an hour, and hopefully there'll be an opportunity for questions and answers to the ministers of health. We have, I think, 8 ministers of health from different countries who are joining us today for this conference, which is very interesting. And then we also have delegates from many other countries in the Gulf and outside the Gulf, who are led by deputy ministers and assistant deputy ministers and leads in the area of mass gathering and public health in their countries. And I think the purpose of having all these expertise and also the political power of having these leaders here is to try to stimulate discussions and have some consensus on trying to build the capacities in the region and globally when it comes to mass gathering medicine. So on behalf of the Ministry of Health and His Excellency the Minister, Dr. Abdullah Rabia, I would like to welcome you all to this meeting, and I am sure it will be an enjoyable 3 days. I know the program is quite hectic and full, but I think your presence and your valuable discussion will make the meeting more successful. So I think I'll move on to the scientific session, which I'm sharing myself and Dr. Brian McCloskey, who represents Public Health England, which is a member of the board. And also we will have some presentations discussing things that have been done over the last 2 or 3 years of planning and coordination. Unfortunately, Dr. Ali Zumla from UCL, who's also a key partner to the Global Center for Mass Gathering Medicine, has not been able to join us because of some medical emergency, and we wish him good luck and fast recovery. But we have his colleagues who are representing him here from University College of London. So I think the first presentation will be for 10 minutes, which basically tells everybody around the room about the history of the Global Center for Mass Gathering Medicine, which will be a good introduction to everybody before the meeting officially starts. And this will take hopefully less than 10 minutes. So Brian, if you allow me, can I start? Yeah. Okay. So, slides are on. So basically the mass gathering is the presence of a group of people, of individuals in the same location in large numbers, to compromise the abilities of the organizers to handle the needs, the health needs and the public health needs of that gathering. Definitions have varied, but people seem to think that 25,000 people would qualify to fit the definition of mass gathering. Of course, all of us in this room agree that mass gathering present a very unique health challenge for public health people working in the area of public health security. We also know that mass gathering related infectious diseases is a subspecialty of global epidemiology, and it's really important for countries to be prepared with enough qualified individuals to be able to manage these emerging infectious diseases in the country of origin of the individuals participating in the mass gathering, and also when they go to the new country and come back. Of course, Hajj is the largest and most long-standing annual mass gathering event on earth. It's been going on for 1400 years. It is the site of some of the greatest crowds densities known to man. We get between 3.5 to 4.5 million people in the same locale for a period of 3 weeks. And over the last few years, the Umrah period, which starts in January each year and continue until the end of Ramadan, which is 3 months before the Hajj, has actually started to attract incredible number of people, reaching up to 6 and 7 and 8 million people. Of course, it's an international event because it has people from different ethnicity, demography, and basically it's a clinically diverse assembly. And of course, because of the global attendance and because there are people coming from 150 or 180 countries, there is interest from the public health agencies across the globe, specifically WHO, to ensure that the IHR regulations are enforced, and then appropriate measures to prevent disease spread are applied, and follow-up is done before, during the event, and after the event. Of course, because of this complex, multifaceted element comprising the preparation for the Hajj, there is definitely a need to ensure that there is a good public health security happening during the event. And also because of the country's ability in Saudi to deal with this surge of large numbers of people, we think that we can actually work together with our partners in different public health agencies across the globe, and also with countries in trying to give advice on some of the gatherings that happen across the globe. And also the surge capacity is important in this public health security, which the country, Saudi Arabia, because of the resources available and the experience they've developed over the years, have gained doing this. And these are some of the pictures to show you the extent of the crowds that happened during the Hajj. This is pictures from the Grand Mosque and outside the Grand Mosque, which shows the amount of individuals. You can imagine if there is an infectious disease that spreads through airborne or aerosol, then the risk of having a massive number of people infected is extremely high. And also this is in Arafat, where again, most of the individuals who perform the Hajj actually spend some time in Arafat. And this is what I was talking about, the issue of the Umrah. This is in the month of Ramadan, and I don't know how well this picture presents, but this is an aerial view of the mosque, the Grand Mosque, in the last 10 days of Ramadan. And you can see that you can actually get people in that mosque, close to 3 million people inside the mosque and outside the mosque performing the Umrah, which again is almost identical to what happens during the Hajj time. And again, that's a closer picture from the palace across the mosque, and you can see the density of the individuals and the people in the mosque. So that's why extensive preparations take place by the Ministry of Health in trying to set policies, recommendations in collaborations with international organizations to make sure that the appropriate vaccinations, precautions, and follow-up are applied on the pilgrims inside the country and outside. Of course, over the years we have gained experience in handling communicable disease and non-communicable disease during mass gatherings. For communicable disease, this is a report that we just published last week in the Euro surveillance that shows that over the last 10 or 11 years, the incidence of meningococcal disease and the evidence of clusters that happened during the Hajj has decreased remarkably. And now, in a whole year, we report only a few cases, sometimes less than 10 in a year, kingdom-wide. And if you look at the distribution of these cases, in the past, the majority of these cases used to come from the Hajj premises, from Mecca, Medina, and Jeddah. Now it is much reduced because of the policies to implement or apply new vaccination requirements. So each pilgrim who comes to us has to have his vaccination card checked at the airport for evidence of receiving the meningococcal quadrivalent vaccine. And anybody who has not received the vaccine is actually given oral ciprofloxacin at the airport so that he can be decolonized if he has carriage of the meningococcal disease. And basically this slide illustrates that we did have a cluster in 2000 and 2001, and that was the last cluster since we applied the quadrivalent meningococcal vaccine. And of course, when it comes to NCD, I think one of the biggest concerns that used to be for the leadership of this country in the past was the issue of stampedes during the Jamarat process of the Hajj, and they invested 1.1 billion riyals in building a state-of-the-art Jamarat bridge, and since then we have not had any incidents of stampedes, which again speaks to the investment in trying to prevent any diseases. This again goes back to the meningococcal disease, and also shows the cases which are related to the Hajj premises versus the cases acquired in different places. That brings us to the idea of developing a mass gathering center, and this happened in 2010 when the custodian of two holy mosques, King Abdullah, led and patroned a meeting on mass gathering medicine, which was held in Jeddah, and also had excellent attendance from scientific community, from ministers in the region, outside the region, and also the Director General of WHO. At that meeting, there was a lot of discussion taking place on the role of WHO in coordinating and assisting countries in managing mass gathering activities, and also how can we get the benefit of the experience gained in the Kingdom of Saudi Arabia. This led to the development of the Jeddah Declaration, which was a very clear declaration set by the scientific committee that was leading that conference, and also was discussed by the panel of ministers at that meeting, and was endorsed by all the 500 attendees of that meeting. The Jeddah Declaration had 6 points: to establish an international reference authority competent with mass gathering health, to be based in the Kingdom of Saudi Arabia, to developing with WHO an integrated framework and plans for health education and information to educate the people attending these activities, and also to develop a training program so that we can develop a cadre of individuals who are competent in managing mass gathering activities, and encourage research and scientific institutions as well as research funding agencies to fund projects into the area of mass gathering medicine, and then to hold a mass gathering conference in the country of reference, which is Saudi, every 3 to 4 years, to be able to update the knowledge and take further actions. Of course, these recommendations were taken forward to many bodies, political bodies, including the GCC Ministers of Health Council, and that was unanimously approved. Then it was taken to the Arab League Ministers of Health meeting in Beirut, Lebanon in March 2011, and it was unanimously endorsed. Then it was taken to the WHO regional meeting, which was held in Cairo in October, and again was unanimously endorsed by all the Ministers of Health. And then in January 2012, it was presented to the WHO Executive Committee and adopted to have a decision on mass gathering medicine. The decision, of course, of the EB was requested the DG to further develop and disseminate multi-sectoral guidance on planning, management, evaluation, and monitoring of all types of mass gathering activities globally. Decided that the DG should, where appropriate, work closely with member states that are planning and conducting mass gathering activities in order to support cooperation and communication between concerned health authorities, and encouraged the Director General to reach out to non-profit making, non-governmental and civil society organizations, including, as appropriate, the private sector in health education related to mass gathering. Requested the DG to raise awareness on health impact of mass gathering and support countries in developing and disseminating the evaluation effective communication strategies, which is for us is very critical to get the right messages to the pilgrims coming to us from so many countries. This led, of course, these resolutions led to the development of the Global Center for Mass Gathering Medicine, which is a collaborating center under the WHO, and this was approved in September 2012, and we were given 4 mandates, which is to develop evidence-based knowledge management and research and publication in the area of mass gathering medicine, establish training program in mass gathering medicine, and advise and consult with international community to strengthen and uphold national endeavors to develop mass gathering health. And that's what the center has been tasked with. So basically, to summarize the milestones, it was the first meeting in October 2010, leading to the Jeddah Declaration, the approval of the GCC Ministers of Health, the support of the Arab League Ministers of Health, the support of the regional office of the WHO, and review at the Executive Board of WHO in Geneva, and of course endorsement by the Assembly. It was presented at the Assembly, and of course the setting of the Global Center for Mass Gathering Medicine as a collaborating center for WHO. And here we are today having the second conference, international conference, with the leaders in public health from different parts of the world participating in this activity to come up with some recommendations and resolutions. Of course, to do that, we had to establish the Global Center Consortium, which is a board led by the Minister of Health and has membership that would include partners who are working with us in scientific manner. WHO, of course, is represented on the board by Mauricio Barbici, who could not join us today because he's been called up to Syria, but also has representation from major public health agencies, including Public Health England, where Brian McCloskey and David Heyman sit on that board, and then, of course, University College of London, which is a very strong partner in making sure that we do the appropriate training internationally and also do state-of-the-art scientific research, and of course the other WHO collaborating centers for mass gathering, which are located in different parts of the world. I think there are 6 so far in South Africa, in Washington DC, in Rome, in London, and a few other countries. I think Brazil will also be a collaborating center. And basically, this is the board meeting led by the Minister of Health, where discussions take place on the priorities for capacity building, training, and also research priorities. Because the board does not have time to discuss the details of these activities, the board has decided that they need to be an scientific advisory board, which I am chairing, and it has at least 45 members of scientific experts who have worked or are working in the field of mass gathering medicine. And we meet once or twice a year. The first meeting took place in May, where again 3 days meeting where we discussed what is known about mass gathering medicine globally, and then what are the needs and priorities based on what's happening currently now in the global community, and basically deliberate on the research priorities, and then ask the scientists and the universities to submit proposals that can be reviewed and accepted by the board for funding and execution in the Hajj time. And basically this is the first meeting of the advisory board that took place here. And of course we are recruiting more members of the scientific advisory board and also of the board, where we want to have leaders of public health agencies across the globe to be partners in that board, so that we can take good decisions that will be supported globally. Future plans, which is the last slide, is to expand the board and the scientific advisory board, and invitations have been extended to certain individuals, not as an individual but as an institution, so that basically they can give their input to the research and the training that takes place to develop this capacity. We want to solicit the highest caliber research. We want to publish reports in the highest impact factor journals, and then basically try to set the benchmark for global standards for managing mass gathering, and hopefully oversee training and development of human capacities in the field. And with that, I think I will stop, and thank you for your attention.